Hi everyone, in this video I'll give you a brief overview of Fragile X syndrome. In terms of some of the basics, it is an X-linked recessive disorder, and it is also the commonest sex-linked learning disability, and it is caused by a repeat in the CGG trinucleotide. In terms of its pathophysiology, there is a mutation in the Fragile X mental retardation 1 gene, also known as FMR1 gene. And there is an expansion in the CGG sequence. So in a normal individual, there'll be less than 50 repeats of the CGG sequence, but as someone with Fragile X, there will be over 200 repeats. This leads to a decrease in the Fragile X mental retardation protein, and this has an impact on the cognitive development of the brain, which leads to the symptoms I'll be discussing later. It can affect men and women, however, because it's an X-linked recessive disorder, men are more commonly affected, and the symptoms are way more severe. The clinical presentation divides into the cognitive and physical features. The main cognitive features are a delay in speech and language with an IQ of less than 70, which leads to a moderate learning difficulty. However, there is also a predisposition to autism and ADHD. The key physical features are a long, thin face, low set ears, as well as macro-orchidism after puberty. And here is a photo of a child with Fragile X, and you can see this thin, long face. The investigations are surrounding the DNA, so you can perform a chorionic villus sampling, amniocentesis, or a blood sample. So here you can see choriocentesis and amniocentesis. Chorionic villus sampling is performed between 11 and 13 plus 6 weeks of gestation, whereas amniocentesis is normally performed from 15 weeks onwards. However, if the child is not diagnosed prenatally, it can be diagnosed postnatally using a regular blood sample, and it would detect those CGG trinucleotide repeats in the DNA. In terms of the management or support, it is divided between individual support and family support. So you want to provide speech therapy and special needs education for the child, as well as some behavioral therapy if they are struggling with autism, for example, and medications such as SSRIs or stimulants for things like ADHD can also be provided. From the family aspect, education, especially surrounding Fragile X, as well as social support and genetic counseling should be given in order to enable the family to understand their child better. I know this is a very brief overview of the condition. If you have any questions about it, please leave them down in the comments. I'm more than happy to answer them. But other than that, thank you so much for watching.